Hello, my name is Carrie Moore, and today we're going to look at a action plan that is in process at my practicum site in Brewster, Washington, that I have been able to participate in both the stakeholder planning process and the early implementation phase. So back in January, I went over the varying course requirements for practicum with my site supervisor, including the advocacy action plan. And I also shared that systems work is a real passion place for me. And I would find a lot of meaning and growth in being able to work on a current systems project at Brewster Middle School. And turns out my timing was really well suited for my site supervisor, Marcy, who was in deep process with trying to get a new action plan off the ground and was seeking a thought partner through some of the planning stages. So, what gap are we trying to close at Brewster Middle School? Access to mental health services. The bonus factor with this particular program, as I'll get into later, is the added benefit of primary healthcare support. The Brewster School District already partners with Okanagan Behavioral Healthcare, which is the main hub of community mental health in Okanagan County, within which is part of this very rural community. OBHC has a school-based clinical mental health care counselor in all school districts across Okanagan County, which is amazing, but it is not currently meeting the need of young people. At Brewster, the school-based CMHC currently has a full caseload and a wait list of 6 to 8 weeks. And this is very typical throughout the school year. The Brewster community does have a handful of private practice options for mental health, but when I investigated their referral process, I found that few see teens or children, and even fewer accept Medicaid for insurance. So, how in a rural community of less than 2,000 people does a school district close the gap? Unsurprisingly, it takes community partners. Some of the most dynamic funding that's coming for school districts through Washington State is not through the Department of Education, but it's through the Department of Health. The locally federally qualified health center, family health centers, received a grant to specifically address medical and behavioral health gaps in rural Washington, especially in agricultural communities like Brewster, who house large migrant communities. So, how does Brewster's counseling program want to tackle this mental health gap? With the school nurse, who would be co employed by family health centers. I was pleasantly surprised to find how comprehensive the data was in the Brewster Middle School nurse's office and how they were already coding exhibiting symptoms of anxiety and depression. All students who visit the nurse's office are tracked and coded via the school's administrative system, which encompasses 3 pages worth of different codes. What you see on the screen here are the ones that we specifically looked at for the referral process. Um, the codes are tracked via Skyward, which is an internal administrative system, and Skyward can be set up to basically have certain people have access, including HIPAA compliance with counseling and nursing. Uh, I worked with the school nurse to go through the February and March data and track students who were coded with explicit mental health symptoms, including BPA, BGA, and BGB. And we also looked at some common comorbidities like stomach ache and headaches and see how many students we found through this matrix. We then ran a semester report to see who in the last about 3 months would qualify. Uh, and this is how the nurse and the counselor would work together, as some students will self-refer to both settings and some will only go to one. So now that we have a list of data-driven referrals, how does the system actually operate? I was able to read through the Memorandum of Understanding, or MOU, between Brewster School District and Family Health Centers and see how they were differentiating their roles between one another and how they were prioritizing certain students. This is super helpful from a counseling and nursing perspective because we still found that our pool of possible referrals was quite large when we were looking at just the February and March data. And how a counseling office prioritizes is ethically different from how the medical field would prioritize. So the MOU utilizes a multi-tiered systems of approach model, MTSS, uh, and prioritizes students into tiers. The third tier that we're highlighting here focuses on students with complex biopsychosocial health needs at the highest priority. So we're looking at students who are presenting in both settings between the counseling department, the nursing department, and they're very frequent flyers to both. Uniquely for this program, it's also prioritizing migrant students, regardless of their health complexity, as these are students who come into the school district and then are gone for several months and come back, and then their intersection with primary health care is very low. So when the phone program fully launches, it will look like this. Via a co-employed school nurse with family health centers and the school district. That nurse and the counselor will create a referral list based on both the nursing office data and the counseling office data and through the lens of the MTSS tiers. They will contact families about the referral and will, with consent, conduct an intake with both the parent or guardian and the student about behavioral health and physical health. Uniquely in the state of Washington, students can access behavioral health care without parental consent from the age of 13 and up, but this particular program does require like the full family kind of input and connection. The support for mental health would be provided for the entire family, and behavioral health services would be provided to the student during the school day in a private office space. This is sort of similar to how Okanagan Behavioral Healthcare already sees students for the clinical mental health setting. I cannot express, as a currently practicing elementary school counselor, how much this excites me and seeing one of our county partners and school districts have this system about to launch really gets me excited to bring something like this to my own school district just an hour and a half away. Thanks.